Hmm.
Record.
Good day. Welcome to another edition of the Africans in America podcast. As always, we have Weruche, Uzoka.
Hey everyone.
Yeah, today we want to talk about something that is very important to everybody in America, healthcare. Access to healthcare in America is very challenging, and it's more challenging for immigrants, whether they are Africans, whether they are Asians, anybody coming to America. Those first few years, first few months, it's a challenge to get access to good healthcare. And in the midst of so many changes, cultural changes, so many shocks, people do get sick. And it's when they get sick, they now find out that healthcare is so different from where they come from. For us in Africa, we know that healthcare is free in many countries and access to drugs is so open. But in America, access to drugs need prescription, needs a whole process that makes it so confounding when you come to America as an African immigrant. And indeed, as an immigrant from anywhere. And these days, healthcare has become so challenging to the extent where we're even hearing that some people now go back to their home countries to access healthcare. We have situations where many Mexicans go back, many Brazilians go back, many people go back. And now, believe it or not, some Nigerians are even being said to go back. The other day, the vice president of Nigeria, Shetima, was boasting that people now come from America, now come from the UK to access healthcare in Nigeria,
Nigeria.
which is very surprising. You would think that America has the best healthcare, and why would people be going back to Africa to go and get healthcare? But anybody who lives in America know that healthcare, access to healthcare in America is very costly, especially if you don't have the almighty insurance.
Mhm.
So I know one or two people who have gone back to have um, different types of surgery, some IVF, some fibroid, some to remove the womb. Many surgeries that are common to both men and to women. Some
Yeah.
kidney, in fact, believe it or not, people go back for kidney operations back in Africa. So today we want to examine access to healthcare for the African immigrant in America here. Weruche, what has been your own particular experience and
Experience.
what are the stories you have been hearing?
Mhm. So for me, because hi everyone. For me, I came with two young kids. I came with toddlers to America. And so once my immigration got granted, I automatically qualified to get healthcare, good healthcare from the state of Connecticut. So that's one of the blessings I always highlight when I talk about living in the Northeast. I believe the Northeast has, I think also Minnesota, I believe, but the Northeast has one of the best like healthcare systems in the country. And so they ensure that pretty much everybody's provided for to a great extent. And so I can say that for me, my personal experience wasn't bad, but that's not to say that I hadn't heard about people who didn't have good health care. Like for instance, an immigrant, right, who has a green card, who just became an immigrant, unfortunately is not, if you don't have like if you don't fall into a certain category, right? Like I fell into the category of an adult with toddlers, right? If you don't fall into that category, unfortunately you'll have to wait 5 years. And personal story, this we experienced this with my mom when she came, right? We had to pay out of pocket, my brother and I, we had to pay out of pocket for her healthcare because everywhere we took her, she just couldn't get healthcare without paying. The good thing is you will get seen by a doctor. Okay, it's unethical for you to walk in with an issue or problem and not be seen. No, you will get seen. Well, give it a few weeks and those checks start coming in the mail. What when I say checks, I mean like those bills start coming in the mail demanding that you pay. And so that's the immigrant experience is most people come here. Most of the people I worked with were refugees. Again, they qualified automatically. Being an asylee, being a refugee, you qualify. However, a lot of other immigrants don't qualify. And so over the years, we've seen a lot of people go back home to get basic health care. And another good thing too that I've seen is, you know how we Africans, we come here, we're doctors, we have a lot of doctor friends and all that. And so you find that you're either going to your uncle or your auntie or your cousin or your high school friend who's a doctor to treat you. You know what I mean? So you find that if you don't have health care, then you dip into your social network to see
Use
who's gonna
social
help
network.
you and all that. So that's been the experience. Yes, definitely. Healthcare is expensive even for Americans. It's extremely expensive, So
Yeah.
yeah, that's
I,
been
I want to talk of one experience when I came in new and I was in New Jersey and I have I have this situation where I have this prescribed drugs that was over the counter in Nigeria, but when you come here, they are prescribed and you need a doctor. And you need a doctor to prescribe them. And when you come, you're really hard on cash. So you go to a place to get prescription to see a doctor, $150. So you're like,
Mhm.
why? Then you go to a pharmacy to get it. So I had this pharmacy in Jamaican was in the counter, and I told
Mhm.
him the drug I wanted, the medicine I wanted, because here too. Believe it or not, you call drug, it has a different meaning from where we come from.
It
We call it drug, they
does.
call it medicine. Yeah, drug has
Medicine,
another meaning
yes.
altogether.
Yes, yes, yes,
And when
yes.
I told the guy, now, how can this be a prescription drug? He said, brother, I know it's not a prescription drug where I come from, but here it's a prescription drug, but I'll work it
Yeah.
out for you. So it's as if it's the sneakiest crime he was committing in the whole world. He just sneakily just gets the medicine for me, counts up like 100, and it's like, man, it was almost like a CIA operation. Just to give.
That's horrible though, because if they catch him, he's
And
gonna,
he was looking this way, looking.
oh my God, that's crazy.
Now we can laugh about it, but that guy was playing with his license just to give me those medicines.
No,
You know, he was
just to
playing with
help
his
you,
license.
just
And
to
this
help.
license, you don't get it easy as a birth certificate. But he was an immigrant too. He said he was from Jamaica and he knows these things too. You know?
Yes,
And
yes,
this brings us to
yes.
this simple topic, right?
Crazy.
At least you must have known of one person who, when you're coming back from a trip, they'll tell you, can you get us antibiotics? Can you get us, I forget the erythromycin, all those common things that have
Yes,
killer bills
yes,
in America, yeah, but
yes.
are affordable in.
Yes, yes. Like some of my friends, because like again, like I said, like in the last conversation, they're doctors. And so they'll buy for themselves. So they go back home and buy for themselves because they know like, okay, this is what they're dealing with. And then when I'm having conversations with them and they're like, oh, I got antibiotics from Nigeria, that kind of thing. They're sharing with you the escapade. Sometimes you talk about suya. The next thing is antibiotics that you got from Nigeria because you don't have to, it's over the counter, you know but it's mild dose, I want to think, like Septrin and all that. So it's okay to do safely. Again, doctors who are aware of the consequences, because those antibiotics over the counter are not, the way Nigerians abuse it, that's another thing to address. It's abused in Nigeria. Those over the counter drugs that people can just access. People self-medicate. That's not good. A lot of people will tell you, oh, I was feeling sick today. You know what? I took what's that malaria drug? And I took this, but they have no clue what's going on with them. So there's the downside to the
Yeah.
availability of those drugs. But when it comes to the cost of healthcare, yes, I've seen a lot of people go back for surgeries. I've seen them go back for surrogacy, right? Very sensitive,
Oh, yeah.
time of their
Yeah.
lives.
Yeah.
Surrogacy, sometimes they've gone back for
IVF.
IVF. It's just been yeah, and we have to say this. The healthcare system in Nigeria is great. The only thing is, if you can't afford it, then you get substandard care. That's the thing. The difference here in America is they're obligated to see you, right? No matter whether, even if you don't have your green card, this thing, you walk in, they will give you treatment, except you will get those bills in the mail. So you see the difference
Yeah, yeah.
there
I,
is,
I, I got an
the
experience like
quality
that
is
too.
pretty much, well, I was going to say the quality of healthcare is pretty much the same. But then I thought about, even an article I wrote where, Black women especially find that, especially women in pregnancy, it's been documented that even in the Department of Health in Connecticut, it's been documented that Black women get really substandard health care in America. And it ends up resulting in like things like, different complications of childbirth. And that's why they've become adamant about requesting a doula. A doula is that person who's going to speak on their behalf while they're having their child. And so it's really yeah, it's not just affordability now, it's also a social thing that you can be given substandard healthcare if you are of a certain demographic,
Yeah.
which ties us into discrimination again. That conversation about discrimination is never ending. It's never ending, So yeah.
Yeah, but I want to also talk about that thing you said that they are obligated to give you the health,
Care.
to give you the health care. I experienced that in New Jersey too. There was
Yeah.
once I think I stepped on a nail, and
Mm.
I stepped on a nail, and I went into there's this beautiful hospital in Newark called Beth Israel. And I went to Beth Israel and they gave me tetanus, gave me a lot of emergency stuff. They answered me. And I thought it was just free to come in like that. At that time, my bill hadn't showed up in my. So I went again. The next time I had one little thing, I went again. And I liked it. They put you on a wheelchair, they wheel you around. But somebody called me and told me, you're gonna pay out of pocket. I say, yeah, what is
Oh
it?
yeah.
Whatever, I don't know, I don't care. Then he said, do you know the amount for this procedure? I said, no, not really. I thought it's free when it's an emergency. He said, no, you're gonna pay $500.
Yeah.
I don't know whether there was a rocket under my bomb, the speed with which I
It's so
jumped out of that
interesting.
wheelchair.
Yes, yes.
And
It's funny.
eventually, my
Mhm.
first bill came. It was 1,500 for my tetanus shot.
Exactly. Hmm.
$1,500 for my tetanus shot. It's the costliest tetanus shot you ever taken on earth. It's
On Earth.
crazy.
Yeah, yeah, yeah. It's funny. I remember when they shut down TikTok. One of the things that because people now moved to Red Note, and so it seemed like for the first time, Americans were having like direct communication with the Chinese, and people were now posting videos talking about how the Chinese were actually asking questions about, oh, we heard that you people pay for your ambulance, is what they said. They said, but we believe it's our government just, spreading propaganda. Americans are like, no, we do pay for our ambulance if we get sick. They're like, really? The Chinese did not believe. So they were now asking Americans direct questions about, our lifestyle. And you won't believe that these Chinese people found our lifestyle to be substandard. They were like, wait, you pay for an ambulance if something happens? Americans are
Yeah,
like, yeah. So it ties back into healthcare is expensive in America, maybe excessively so, even because think about Turkey. Turkey is where everybody's going to get their teeth done,
their
get
hair.
comprehensive their hair done, and to get comprehensive checkup. You know what I mean for their healthcare checkup. And so it begs the question, um, what is the gain if the average citizen cannot afford? What is the gain to the country if the average citizen cannot afford good health care without having to go to, imagine if you don't have a job that gives you good, insurance, right? Good benefits, or if you don't have toddlers so you can fit into the state's
Yeah,
plan. So what happens? You're in
yeah,
limbo
it's
and
a
you're an
privilege.
American
It's a privilege
citizen.
to a large extent because
And these
you
were the
have to be
things that I
privileged.
advocated. Yeah, these were the
Mm.
things I advocated for when I ran for office. Better health care, better education, better health care.
Yeah.
So yeah.
Uh, Remember, going back to what you said about the ambulance, you got to pay for it. My friend was telling me how she got hit by a car from behind, and
Mm,
first thing to show up was EMS, and before even the police. And when she sorted out the police, and are you injured? Are you sick? And everything, yes. and she was about to get onto the ambulance, and somebody who she was speaking with on the phone now told her that if you just allow them carry you into the ambulance, that's a $1,000 bill waiting for you.
No, it's about 7 or 8,000 in Connecticut, I believe.
Oh dear. So 1,000, 1,000 is people, it's 8,000. And you know that, do you know how long it takes to work for 8,000 in
Yeah,
America?
it's
Whatever job
expensive.
you have. It's a
It's
lot of
expensive.
money to work for. And you know, that's how come people fall into debt, and almost healthcare debt is one of the biggest holes people almost never come out of.
Yeah,
Especially
and
if you
that's
now
why
have
Republic.
some other real surgery or something like that. And maybe that's why they go
Yeah.
back home to Africa.
Yes, yes.
Mhm.
That's why progressives are pushing for universal health care. It makes sense. If you go to Europe, many countries, the citizens don't have to pay health care. You just go, you get treated. When I went visiting in London, I was pregnant with my second child, and I was there for a few weeks. I hadn't seen a doctor, and I was just walking to Tesco, and I walked into a doctor's office, and I'm like, I haven't seen a doctor. They're like, you're kidding. You're pregnant. They did all the tests. They immediately gave me an NHS number. Well, it took a couple of days and it was mailed to the house. I told them I'm a visitor. Like, I'm here. I'm just visiting. And they panicked because I was pregnant with a child. They called the house, they sent me NHS number. Eventually, a couple of weeks later, I left for Nigeria. But the point is, just the fact that I was pregnant with a child, right? They were like, you've not seen a doctor? Immediately, they took me in. And before I knew it, I was approved for the NHS, just like that. And it was
Okay.
useless because I ended up not using it. I left. I went back to Nigeria, but I'm just trying to tell you that other countries have better healthcare systems. And so when Democrats fight, I'm not trying to be a politician as we speak. I'm doing my very best not to advocate. You know that, right? But I have to say certain things. When Democrats advocate for universal healthcare, there is a reason. Healthcare is our lifeline. You know what I mean? And it's important that we make sure we do what we have to do to make sure everybody gets healthcare. It shouldn't be about your status or your race. I just had to say that. I'm sorry. I'm not trying to
Yeah,
advocate.
okay. But we should point out certain things. Let us start
Mhm.
to know. Sometimes when we do programs like this, we are trying to inform people to there are pathways to better healthcare. Any Nigerian who is able to go, any Kenyan who is able to go back to Kenya, or a Ghanaian who is able to go back to Ghana, has achieved a serious milestone already in America. That means they've got a green card, or they've got a right to travel, a parole travel document. It's not so for quite a lot of people. A lot of people are still within that process of trying to sort themselves out. And even if you're an asylum, you cannot go back. You know, you're not going back to the
And
country from which you're running. You know, so many people can't go back to Africa, and but they are here in America, yeah. And even though we do agree that it is very expensive to get healthcare, there are still pathways. We know that a lot of churches, like you just said, faith-based organizations especially try to create pathways. They try to get doctors to do pro bono services. And we also know that the state and community, I don't know how they call them, community health centers in all the towns and all the cities. They have these community health centers. If you're an immigrant who is going through the process of validating your stay, you will be made to go and get some of these. I think it's a 685 I-685. So you do a lot of shots, vaccines. You take a lot of vaccinations in
yes.
those places. Those community health centers also provide healthcare services. Then
Hmm.
beyond that, also, if you go to an hospital as an for an emergency case, you actually have access to a lot of pro bono. They have a lot of charity organizations that will take care of those things. But what they want to know is that you truly do not have a job. They don't want you gaming
Hmm.
the system. They want to be sure that
Yes.
you're not earning an income and then you're
And
trying to
then
game the system. So, and even if
exactly.
you eventually start earning, they expect you to make some contributions. So if you go to like in Austin, where I am here now, I know many of they have the Billisket White and they have Essential Status. They have all these big, huge healthcare groups. I think in New York, it's the Mount Sinai group. They have these systems, healthcare systems in America. And when you go to get a service from them, if it's an emergency service, they will provide it for you, as you have already said. But they will also create for you the pathway. They will show you which documents you need to get your bills cleared, and it will help to prove that your bills have been cleared. But it's the daily living, it's the daily prescription, it's the daily pain, all those little things, and those are the ones that are a little bit difficult. Do you know any other ways by which people can access better healthcare?
Like you said, it's the churches, it's the like the refugee ministries, if you have those. Sometimes the hospitals have programs too.
Mm-hmm.
If you go to the hospital, they will ask you your status, and then they could send you to one or two programs that, maybe privately funded, sometimes foundations, people have private foundations that help assist. But like you said, they have to go through the rigorous vetting process, but it's worth it because if you really do not have health care based on not having income, not having a job, then the resources are out there. You just have to find it. You know what I mean? It's not like something that's alien, they will help, they will grant it because that's the purpose of the funding that they have, So yes, that's really it. The churches help a lot. The churches might not help with providing the actual healthcare, obviously, but they will give you funding, a little thing here and there that can assist you. For the refugees and the immigrants, it's usually those refugee ministries that help. So there are resources everywhere. Like Yale always has like a whole list of things. It's not just healthcare now. It's also like food on wheels for sick people, where they have programs where they come and they bring food for disabled people who are immobile and can't leave, right? They have programs for like transportation to get them to the healthcare place and back. They have different programs that, especially with for the elderly as well, and the elderly that don't have people to take care of them. So yeah, it's that.
Yeah,
Yeah.
well, as I've been saying, if anybody has comments regarding this topic we're discussing today, please put comments. Tell us how you access healthcare. Tell us pathways for it for immigrants. You should all know that immigrants are transitioning. Many are in the beginning part of their immigration process, and some are now citizens. So
Mhm.
and it's not the same. Some are still in the process of not having the best jobs. They've not even started to get work-related benefits, and while some are enjoying benefits. And so,
Yes.
whoever has information as to how we can get this access to healthcare services for immigrants, please put in the comment section there. Um,
Mhm.
let us talk now a little bit. I want to talk
Mhm.
about personal experiences also,
Mhm.
I was in Washington the other day and I met
Mhm.
somebody who is in one of these community health centers, and
Mhm.
she was telling me, she's a Nigerian, she was telling me that, look, they have a lot of offerings for people because that people don't know. And when I had to access the community center, I saw that there are a lot of them who knew were taking very good advantage of them. They always have them. They have them in the cities. I think it's just to Google and to find out which. But I guess
Yes.
because of people's immigration status, they tend to be shy about it. They don't know
Yes.
whether they will ask them for this and ask them for that. Because the way America works, first thing they will do, show us your ID. That one alone will
Yes.
just make a
Yes.
lot of people.
Yeah,
So,
there's a lot of fear and mistrust. Yes,
yeah,
definitely.
ID. You know?
Yes, 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 yes. No, no,
Especially
no.
in this environment we are in now,
Mhm.
when they
Mhm.
ask for state ID, they ask for this one and that one. Do you have an address? It makes it very frightening for anybody who is still transitioning. We are all when we call immigrants. People just think that is the one who is the first generation who has become a citizen. It's a lie. Some people just arrived yesterday and they are
Yeah.
just trying to sort
To
themselves out.
survive. Yeah. One of the issues that I've seen with, after working with refugees and, all of that, even my personal experience, to be honest, but is okay, I'll talk about my experience later, but the refugees is there's a fear, right? Because you come with PTSD. Refugees are typically people who have suffered persecution in their home countries and have had to live in another country. And so they don't come here fully themselves. Does that make any sense? And then they come here and
Mhm.
then depending on where they are, if they don't have society, community around them, there's depression rates are high and all that. And so when
Mhm.
they go to the hospital, they need they need like the people who can help translate for them, who can help speak for them. Because first of all, translation is a problem because they don't speak. Sometimes they
Oh,
speak
yeah,
with heavy
language barriers.
accents.
Yeah.
So there's that language barrier of a thing. And so when they come here, they don't have people that understand them. So, but yeah, so that's very necessary to highlight is the fact that refugees sometimes will not go or immigrants will not go to the hospital because maybe their one or two last experiences that wasn't favorable. I remember when my dad passed, right? My dad passed and I had to go to because I was really, like sad and all of that. And I went to see psychiatrists just because my dad passed and all that. And I found him asking me more questions about my background and all of that. Like he didn't understand certain things like, okay, Nigeria and all of that. He just was not, he knew Nigeria, but you could tell that he couldn't relate to me in that moment. And in that moment, that wasn't who I wanted. Who could have been the best option for me. I needed someone who could understand me and understand what I'm experiencing in the moment, as opposed to needing to understand my background. And so it became a plea, it became one of these advocacy focuses that it's necessary to have enough immigrant doctors. It's necessary because it doesn't just serve the purpose, it serves the purpose of helping create a sense of familiarity for immigrants. You understand what I'm saying? For immigrants who do not have the ability to, or who need people who can understand them. Imagine somebody going through something really serious, and then because you don't understand their background, you're setting them behind. You're asking them questions about, oh, where they were born and this and that, and you don't understand their name. You can't say their name. In that moment, this person is needing help. They're seeking help. They're coming to you, and you can clearly not. They're alien to you. And so there should be a better way of matching these people with people who genuinely understand. I know a lot of psychiatrists that are white that have traveled the world. Listen, I met someone one time and I said to him I was from Nigeria, and the first thing he said is Lagos, white man, and he pronounced it exactly right. What am I saying? There are people who take the time to do it. But the point is the healthcare system should consciously try to match these people with people who are familiar with them. Does that make any sense? As opposed to just leaving them to just deal with people who might appear dismissive, might be culturally separated from them. Does that make any sense?
Yeah, but I understand what you mean. I've seen it. For us Africans, yeah, we have a disproportionate representation in the healthcare sector, either as caregivers, as nurses, and as doctors, because we tend to gravitate towards the healthcare people. But you won't believe this. If you meet an African nurse, Cameroon, Kenyan, from wherever in Africa, or even from Nigeria, the whole healthcare practice has so polished them that if you just say, are you Nigerian? There's a process by which they go through. There's a protocol, a procedure. They try not to show that they know you. They at that moment they are very you will be
Professional.
It's so shocking for any African that you're interfacing with an African nurse, an African doctor, and it is it is as if he doesn't know you. That's how the American system has processed them. They have
Yeah, due to
learned to
conflict
live
of
that way.
interest.
Maybe in
Mhm.
another setting, a social setting. And even if you dare say something like, my sister, so you're from Kenya, you're from Ghana, you're from this, can I have your number? Things we do very easily here. The protocol here is not to be nothing. It's if you be like,
Due to conflict
what
of
do you want
interest,
to
yes.
know? You
Yes,
can get
yes.
to me through the app, but you want that after something so that you can say, I have this back pain, or you can relate the way you relate in Africa. But it
No, I
doesn't,
agree.
it's not that way. It's
No, it
not
doesn't
that
work
way
that
here.
way. No, 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 I agree with you. After a couple of experiences, I had to start requesting the kind of doctors I wanted. When I had to start being specific to even the race, sometimes even the gender, simply
Wow.
because it made it easier for me because I wanted people who could understand me. You understand? Not language barrier wise, because we speak English, but it's sort of like people who understand what you're going through physically, really, and that, but it improved for me. For me, like I said, I've had good experiences, but I'm just one of the anomalies. I've had good experiences. Sometimes I haven't had as good experiences, but when you look at it again in totality, I'm more grateful for the quality and of healthcare I've
Yeah.
received than not. I'm okay with it, but I do still see women who complain, especially African American women who do not get the same level of care as compared to their white counterparts. And so, it's something we can't ignore that it's the racism and discrimination still exists in that world. And I mean, the more we speak about it, hopefully, the more awareness we bring. And change comes when you talk about things, right? You talk about things to improve situations. So it's never a bad thing to advocate for good health care. What we're hoping is universal health care, so people don't have to worry about insurance. Take it out of their taxes. Take it out of their taxes so they don't have to feel it. You know what I mean? Yeah.
Yeah. Yeah, well, we know that someday this topic is just between me and you now. We are not there are African healthcare practitioners in the healthcare space. One day we will get one or two of them to talk. It's a topic, most of the topics we have
Mhm.
discussed are topics we will revisit. We will revisit it
Correct.
the more we get people who are more knowledgeable in some other, the one day
Mhm.
we'll get a doctor, we'll get a nurse, get health
Yes.
practitioners. We'll get people who have probably gone back to Africa to go and access healthcare. Like I told you, your ability to go back to Africa to access healthcare is a privilege because it simply means you have a green card, you have a travel document, or an American passport. But some people are not there yet,
Correct.
and they're in America and they have to access healthcare. And for those people who have to access healthcare, they should know this: community health centers are a very good resource. Go find a church that is affiliated, that you are affiliated to, or that has something to do with your country. Nigerians know Redeemed Church. We know all our Catholic churches. We know our Winners Chapel. They have systems that try to get healthcare to people, and
Correct.
people too should explore all the find out, Google, try and learn about available philanthropic
Resources.
organizations that help people for surgeries. For some people want to do fibroid surgeries. They have people who help you do it. 100% covered, but all your insurance is covered. They are there. It's just for you to make the effort to know it. They are there. Believe me, they are there. Someday we'll get more people who are experts on this topic to be part of our program. But today, this
Well,
is the much we can take. Thank you very much for being a part of our program today. Share this program, like this program, subscribe to this program. We will continue to grow this program one person at a time, one subscriber at a time until we get to where we want to get to. Thank you for being this part of this program and have a good day. Don't forget, like, share, subscribe. And leave a comment. Leave a comment. Always just leave a comment. Thank you very much. Have a wonderful day.
Yeah.